Thank you very much, Cheryl, and good morning, everyone. I'd like to thank the National Metropolis Conference for the opportunity to join you today. I was really pleased to see a plenary session on the issue of immigration and health in this year's conference. Health challenges are very significant for immigrants to Canada, and more needs to be done in order to understand them and address them. I'm going to talk today from the perspective of a local service delivery organization, a local health service organization in Canada's largest city, about how we work to address health needs of immigrants and reduce the health disparities that immigrants face. I'm going to talk a little bit about the health status of immigrants in Canada, or in Toronto rather, and some of the unique challenges that immigration and the settlement process pose for public health. I'm going to finish by talking a little bit about some of the on-the-ground strategies that we employ to address health in immigrant communities. Now, when I talk to immigrants in terms of language, I'm trying to be inclusive here, referring to all categories of immigrants who we may serve, those who have been in Toronto for many, many years, as well as those who are recently arrived, and of course all categories of immigrants, whether landed, refugees, foreign students, or migrant workers. A bit about Toronto Public Health. It is the city's public health service. It's an agency of the local government. It is part of our core mandate to reduce health inequalities as well as improve the health of the entire population. Unlike some health services like hospitals, people don't necessarily come to us. We have a small number of clinical services, but mostly the 1,900 people who work in Toronto Public Health are out in the community. They're in people's homes, in schools, in restaurants, and community centers, and they see firsthand the lived experience of immigrants and how the social determinants of health, like income, education, housing, affect their health. In addition, because we're an agency of the city, we have close working relationships with other municipal services like social assistance, housing, and recreation, which are critical for the settlement of immigrants. And we heard from Patricia Warwick this morning a plea for greater involvement of cities and municipal governments in the settlement process, and I would certainly concur with that. The City of Toronto has had for a number of years a memorandum of understanding with the Ontario and federal governments to collaborate on services for newcomers, and we've, as a city agency, have benefited from that a little bit, in particular recently with some funding we've received to help us do a better job in this area. Now, I don't have to say a lot to this audience about the role that the City of Toronto plays in patterns of migration to Canada. 500,000 immigrants and refugees have settled in the city over the past 10 years, and nearly another 500,000 in the surrounding Greater Toronto area. Half of our population is foreign-born, and of course that creates a community with enormous diversity. And in many ways, I think Toronto is on the front lines in managing the coming diversity that Howard Duncan was speaking about just before the break. So it's not surprising that the city government and its agencies, including Toronto Public Health, have a formal commitment to diversity. And in fact, the city's motto is "Diversity, Our Strength," which is an explicit recognition of community diversity as an asset rather than a problem. Many of our programs and services have a dedicated focus on access and equity, and specific policies are aimed at inclusion for immigrants and others. So why is the settlement experience so important for people's health? Well, much of the discussion that I've heard at the conference today has focused on some of the challenges that newcomers to this country face in achieving economic success, and this has enormous implications for their health. Income, and poverty in particular, is one of the most powerful and potent determinants of health. In the City of Toronto, people who live in the lowest income communities, men, for example, live 4.5 years shorter lives than men who live in wealthier communities. And you can see the same pattern at almost any health outcome that you look at. People living with low incomes are more often hospitalized. They more often have communicable diseases. Their babies are smaller and less healthy. There's a very pervasive effect of poverty. And the fact that about a half of recent immigrants are living in poverty is a big, big impact on their health. Another area which is very important, which from a health point of view, although you probably think about it from other points of view, is racialization, discrimination, and social exclusion. The vast majority of recent immigrants to Toronto, of course, are from racialized communities, or what StatsCan defines as visible minorities. And we know that about a quarter of them report, if they're asked, that they have experienced discrimination, which is about 2.5 times the rate for Canadian-born residents. There's a great body of evidence that documents that people who have been victims of racism and discrimination are at increased risk of physical and particularly mental illness. So this is another very significant health challenge facing newcomers to the city. So how do these social determinants of health translate into health outcomes for immigrants? Well, it's a complex picture. On some measures, immigrants arrive in this country, particularly planned immigrants, landed immigrants, in better health than their Canadian-born counterparts, particularly when it comes to some measures of risk for chronic disease and chronic diseases itself. But this so-called healthy immigrant effect doesn't tell the whole story. It's much more complex than that. Recent immigrants have higher rates of certain communicable diseases, particularly HIV and tuberculosis. And for some risk factors for chronic disease, for example, physical activity, recent immigrants are actually less active and therefore less protected against chronic illness than Canadian-born individuals. We do know that some of the measures of better health which are experienced by newcomers decline over time, and so that as newcomers become more established, they're significantly more likely to experience the risk factors and outcomes of chronic disease. And once they become much more established, after 10 or 15 years, we start to see actually higher rates of chronic diseases like diabetes and heart disease and cancer than those who are Canadian-born. Now, it's important to interpret these findings about trends in health over the settlement trajectory with caution, because much of it is based not on what we would like, longitudinal, generational studies of groups of cohorts of immigrants, but rather based on cross-sectional studies comparing more recent immigrants with those of an earlier generation. And as we know, there are many differences between the immigrants who are arriving in Canada and in Toronto today. They come from different countries, they experience more challenges in economic integration, all of which is very important for their health. We may also be seeing some differences in terms of the health that people arrive with, because as developing countries develop, they start to take on some of the health attributes of more developed societies, and some of that protective effect of the healthy immigrant effect may decline as we see countries of origin change themselves. It's also important to recognize that immigrants, of course, are not a monolithic group. There are some groups of immigrants from the data who are clearly more vulnerable than others to this impact of declining health over time, particularly seniors, women, those at the lowest income levels, and those that are racialized. Country of origin makes a big difference, of course, and the category of immigration is also very important. So, for example, refugees on average are less healthy on arrival than planned immigrants, in part because of the experiences that they've gone through in order to arrive in this country. So these are some of the health challenges faced by immigrants. I want to move on to what we might be doing about it, what we're trying to do about it in Toronto. Now, public health as a service delivery agency is only one piece of the puzzle. Clearly, we have a very limited ability to influence the social determinants of health, which are at the root of health challenges for immigrants. We have a very limited ability to influence federal and provincial policy, although we try mightily through advocacy. And lastly, we are hampered by a real lack of comprehensive data on immigrant health, and I'm going to come back to that at the end of my remarks and some of the things that I think we need to do about that.